you'll have that as a backdrop because we'll be going over some of the information on our website. And again, today's purpose is to give you a high-level kind of overview of what's available in Therap for both the initial statewide rollout and also for your future implementation and use of various aspects of the system. I've muted everybody, and if you have a question, over on your panel, there's an area that says chat, and you can type a question in there, and Deborah will attempt to answer those questions or jump in verbally. So we may answer some questions by a message back to you, and then she also may find it best for her or myself to answer the questions for all of you at the same time. So we'll handle things that way. One of the things I wanted to kind of go over very briefly with you is I'm quite sure that a lot of you have questions about what's coming out when, what's going to be required, and all of those things. Really today our primary purpose is to give you just a good overview of the system, and I know a lot of you are scheduled to be at our national conference in Atlanta next week. There are just short of 200 folks from South Carolina that'll be attending that conference, and there are a lot of concurrent sessions and lots of presentations that you're going to find very, very useful for those of you that are going. One of the things that you might find a little challenging is how to choose where to go and what to participate in. So one of our goals today is to try to give you a good overview so that you'll then have a good idea of what it is that you want to participate in at the national conference. And of course, there'll be lots of staff there available to help you also with making those decisions. In addition to next week's national conference, there is another conference that most of you should know about or will know about soon, and that's going to be in Myrtle Beach in February, which is the Human Service Providers Association's conference. And Therap also is doing several sessions at that conference. We'll be doing a pre-conference session for current users of Therap, and then we'll be having all day on Thursday of that conference. We'll have multiple sessions for beginner use of the system, like first introduction and orientation. And also then there'll be a session as well for provider administrators to get into more of the detail and meat of setting up the system and that kind of thing. So let's see, Deborah, anything else you want to handle before we kind of get into things here?
I don't think so.
Okay. All right. Well, one of the first things that I will try to address, since I know there are a lot of questions, is timelines. So our timelines for rolling out the first round, what we're calling round one, is April 1st. So many of your organizations are getting calls from our state project manager, who is Jeff Covington. So he's going to be in contact or has been in contact with your organization to set up your first training sessions. We also have training sessions being scheduled right at the conference, and an email went out just a little while ago to directors of agencies letting them know what sessions there are specific invitations to each of you to attend. So April 1st is round one, and I'm sure you're wondering, what does round one mean? So round one is creating and setting up your account in Therap for your agency, creating individual data records, which are demographics, utilization of the secure communication system, which we'll talk a little bit about this morning, key logs, which again you'll be hearing a lot about that term, key logs, general event reports, which is incident reporting, and health tracking, basic health tracking data such as vitals, doctor's appointments, seizures, blood glucose tracking, and those kinds of things. Those will be part of the initial rollout, which will occur around April 1st. The second round is projected for July 1st, and the second round will include the MARS, Medication Administration Records. And then the third round, which again, we can scroll down, and we will see the third round is scheduled for October 1st, and the third round will include ISP programs and ISP data, collecting that data, being able to run reports on that data, behavior documentation and extended health documentation in round 4, and then the training management system and personal finance in round 5. And so those are all part of this first rollout, which occurs again April 1st, July 1st, October 1st. We'll talk more about this in coming months, and there'll be a lot of communication to everybody, which hopefully you will find complete and helpful. So let me begin here and talk about our website. There are a number of places that you all can go, a lot of resources where you can get more information about things happening with Therap in South Carolina. This is our website that you're currently looking at, and there will be a South Carolina specific website that is going to be created. In fact, currently we have a South Carolina website, but it's not been designed specifically for our state contract. So that will be rolling out in the near future, and we'll be notifying you where you can go to that site and get very specific information to the state. But within this website here, of course, you have these areas that you can go and click on. In fact, the Therap team here, if we go down to the southeast, you'll see myself, Jason Laws, who's in Georgia, Shay Dotson is one of our trainers, Johanna Croft is one of our trainers, and then Deborah should be in here somewhere. There's Deborah. So here's Deborah, so you know who Deborah is. And then a lot of you will get the meeting Jeff Covington, who again is our state project manager. Within our website, there are a lot of resources for you. One is just if you click catalogs, you'll be able to look at some specific catalogs. This is our national catalog, which has all of our modules in it. But as you scroll down, this is a catalog regarding our conference coming up next week. There's some other like quality assurance tools, some other generic kinds of catalogs. This one specifically to address the mobile app for Android. In addition to that, this conference button here will tell you about the various conferences that we have coming up around the country. And to bring your attention to this one here is a South Carolina specific conference in Columbia. That'll be May 12th and May 13th. That'll be between the first round of rollout and the second round, so it'll be a great opportunity to learn some enhanced advanced skills and things that you, questions you may have, very specific, and there'll be, it's kind of a mini national conference. So those are some things, a great way for you to go and learn about more information. Also under this help and support link at the very top, this will take us to our help and support page where you have a training link where we can actually view automated trainings. Many of our modules have had recorded trainings that you can use once Therap comes and trains your staff and you have turnover and that kind of thing. You'll want to use this resource and other resources we have, which we'll be sharing on how you can use these various trainings to support your staff's needs. And I'll run one of these real quick for you so you can see, kind of get an idea of how it works.
Welcome to the Introduction to Therap. You're going to love this. Maybe you've worked in this field before, and you're used to doing a lot of paperwork. You'll be happy to know that this system will eliminate some of that paperwork. You can use TLOC for your everyday progress notes, shift notes, etc. Use GERs for your incident reports. Use SCOM, like email, to communicate with staff at your agency.
I'm going to pause it there, but just so you get an idea of how they're rather lighthearted and easy to watch, and with some humor. As you can see, she's moving her eyes around and looking at you, and we try to make things enjoyable and interactive for all staff. But you'll find that these are really great resources. As well, you have a user guide that you can click under various areas to learn more about each of those, such as, what is the personal finance module, or want to get more information about support plans, and you can click on that, and then it'll give you subcategories that you can then review. Quick guides is another way to access topic-specific things very, very quickly. Frequently asked questions is a great place to go to review, obviously, some of those areas where folks have asked questions and they may be similar to your questions. Webinars, these are great. We do lots and lots of webinars. There's something called the Lunch and Learning Lunch, and you can see what's coming up and what the topics are, and you can participate in any of those. And again, topic-specific areas. Another area of resources that we have available is on YouTube. If you are able to access YouTube at your agency, we have a YouTube channel. It's Therap Services. And you have an opportunity to search by topic by clicking the search button. We can look at what's been recently uploaded. We have general information. We have a Show Me How section, a Therap for State section, and recent uploads. Something that we're working on that you'll be hearing more about is called the Therap Training Academy. So you could go and watch this video, and I'll tell you about the Training Academy and what that's all about. And there are literally hundreds and hundreds of videos. Go ahead, Deborah.
Sorry. That Training Academy, we'll actually be sending you some of that information as well at the conference, just to give you a little extra training on how to set up your account. So.
Great, thank you. So going back to our website, another thing you'll see on our website is something called Live Help. And Live Help will give you, when you click that, we'll have somebody that will come on the screen and have a conversation with you. The people that you'll be talking to are clinicians like yourself, people who have been in the field. Everyone who works for Therap has come out of the field and used Therap for some time, so in order to provide you with the best possible support and assistance. So we'll also see, I'll show you when we log into the Therap system, you'll see that it's available to use Live Help right within the system as well. So I'm going to do that now. I'm going to click the Secure Login button here, which will take me to a login screen. And of course, each of you will get a login name that you'll type in, and each of you will have your own unique password. Login names or passwords are personal and private and things that you keep to yourself and absolutely never share with another person. Because when you do enter into Therap, once you, under a login name and a password, it's going to create an electronic signature of your name the moment you log in. So there's going to be a tracking system that you were in the system at a certain time, and wherever you go and do something in Therap, it's going to stamp that you were there doing various activities such as reading it or entering a note and so on. So you want to be very, very cautious and secure with your username and your password. Each agency will have a provider code. And that's where your agency's specific electronic records and documentation will be maintained. So I am going to go ahead and let me log in with a different username. And I'm going to go ahead and log into an account. Now, a couple of things that we have set up that your agency may choose to set up is a couple of communication tools. And this first thing that you see on the screen that's called Acknowledgement of Electronic Signature, this is called an agreement in the system. And what it requires you to do before you can get in and do your job, reading and documenting services, is it requires you to read this. This is an example of an agreement or a policy. This is called Acknowledgement of Electronic Signature. I understand acknowledge when I access and utilize Therap that all documentation in the system is considered a valid electronic signature. So once I've read that, I can click this I agree button, and that's going to take me into the system. It's also going to create an electronic signature. So when I do that, it's now going to create a log that says Barry Pollock, and my job title, which up here it recognizes me as Barry Pollock Executive Director. It's going to stamp that now that I've read that policy and agreed to it, and the date and the time that I did that. The next thing that you see pop up here is just an example that agencies have a choice of communicating and putting these up. They're called splash pages. And a splash page is simply a way to inform staff rather than the old-fashioned method of putting a flyer or a message in somebody's mailbox or sending something out around external email. This is actually a way that everybody can get the same message at the same time when they log in. And this is just a sample, such as communicating an in-service training or a fundraiser or a special meeting of some kind that everybody's required to attend. So if you didn't have either of those things set up, then what would come up is what you're seeing now, and this is called the dashboard. Again, you'll see that the system recognizes who I am from my login and my title, and I have a role in the system that determines what gets turned on and what gets turned off. And that's connected to my ID of Barry Pollock Executive Director. So in this system, I am considered a provider administrator. So everything has been turned on. I have access to everything and all individuals that we serve because I'm an administrator. And you can see there's an awful lot here. You'll see that the tabs on the left-hand side are like a medical record that you would grab a tab and open that tab up, and what's behind it is all those forms or the various things that relate to that area, and it's the same thing in Therap. When I click the Health tab, then all of the health-related kinds of functionality and modules pop up, and that would apply to each one of these areas. On the right-hand side, we're going to see a fixed panel. That will be there all the time. And we'll go over what some of those things are. And then on the very bottom, there's a fixed panel, which also gives you the opportunity to go to Live Help directly from here, to jump over to the website, to look at any information you need there. Ideas is something that we have available where you can share an idea or read other ideas about what folks have posted and would like to see in Therap in the future. And feedback is a way to communicate something to Therap, a question or a problem, and some information that you need feedback on. And of course, the help and support button takes you back to that help and support page that we were looking at on the Therap website. So looking at all of this, it may look like a lot, but let me log out, and I'm going to log back in as a different user. I'll log in as a DSP into my demo account here. There we go. And we'll see the same things pop up as before. And this might look a little different. You'll see the system up in the upper right-hand corner sees this is Barry Pollock Direct Support Professional, or DSP, and now I only have access to the things that my provider agency has turned on for my profile. So we see I now don't have all the tabs that were out here before. we could see those fixed on the right and fixed panels, and on the bottom are still there. But now I only see very limited information. We're going to talk a little bit about this to-do tab here in just a moment. But my individual tab, you might recall all those things that were under the tabs before. Well, now I only have the things that I need to do my job. And the individual home tab here, this individual home page, is how I get to basically my caseload, individuals that I'm serving. And I'm serving these 3 people, so I wouldn't have access to any other individuals unless my provider agency gave me access to some additional folks. So, for example, if I work in a group home, I'm able to see everybody in that group home. And maybe on the weekend, I'm asked to do weekend relief at a different home. If I work regularly in that home on the weekends, then that would be part of my caseload, and I would see those individuals. But if I'm on call and I don't work on a regular basis in that home or in that program, my provider administrator can go in and add that caseload by clicking it right next to my name, and then I will have access to those records. And when my shift's over, if that's not a typical program that I would work in, then my provider administrator would go in and remove that from my super role, from that caseload from my role, so that I would no longer have access to those individual records. So you can see how different this looks for each individual based on your role in the system. I'm going to log out, and I'm going to log back in to my other account. So as I said before, this To-Do tab is looking back at Barry Pollock, Executive Director, and I have something in this system that's called a super role. And the super role, which is an administrator role, is what determines what gets turned on and off for me. So if I go in and look at a super role, and maybe we'll look at a direct care role. What happens here is that the administrators of each agency will determine who has access to what parts of the system and purely click on the button next to the description of what my provider would like me to have access to. So you can see as a DSP here, as a direct care, I can collect data on a goal. I can view a behavior plan. I can enter a behavioral event, and I have access to a few other pieces of information. But a lot of things I don't have access to because it doesn't impact my job, and that's one less thing I have to look at on my screen. And that's basically what a super role is. Caseloads are exactly what it sounds like. Caseloads can be a program, caseloads can be an individual, caseloads can be groups of individuals. And so again, your provider administrator will create caseloads and then assign them to each employee. So what I'd like to do is go through each of these tabs and kind of talk briefly about some of the areas and what those terms mean, so that when you're thinking about what you would use Therap for and more training that you'd like on those areas, you'll know what they are. So under the individual tab, you're going to see something called T-logs, and T-logs will be part of round 1 rollout in South Carolina. The best way to think about a T-log is a communication log. So in residential homes where you have a shift log or a communication log book within each facility, this will take the place of that. Other things that T-logs are used for is for basically any type of documentation that is not related to healthcare, although sometimes we do use both the healthcare section and the communication log to communicate issues about healthcare. But anything that you would want to report on, like ISP data, collecting goals and then running a report on on the accomplishment of those goals, you wouldn't want to put goal-related data in a T-log. You also wouldn't want to put like seizure information or things that you would want to run a report on later on. That would occur in the health tracking section. But a T-log is a great place to identify that you've spoken to somebody about something, or something's going to happen, or something did happen. So on this to-do tab here, when anybody enters a note about somebody that I serve, then it's going to pop up on my dashboard, and I can now review these notes individually or go through them all at once. So I see here that we have an appointment. I see that George has an appointment today. He'll be picked up at the date program 8:45. This was written by Barry Pollock, DSP, this morning at 7:55. We can go up here and see who's read this note. So this note was read by Barry Pollock at 7:55. We can add a follow-up to this. We can do a number of different things. And notes can be shared with other programs as well. So when I come in and I'm able to look at my T-log here, and I can mark this as read and go to the next note and quickly see that George has got up this morning. This is a shift note here. We see he ate breakfast, he had some behaviors going on, etc. Again, I can mark this as read and go to next and continue on with that. I also, if I have the privileging to do so, can do a search for notes. So I can do a search for notes by program or by an individual. I'll go back a little bit here. Now I can look for health notes. I can look for behavior notes, contact notes. Maybe we'll just look for all notes in the system. And I can see I've got this is the notes that have been entered in the system since December 1st on this individual. I might want to sort these notes out so that I can put them in a alphabetical order or date order. And now I can go back through and open any one of these up and read them. We can see we have several shift notes. There's referrals, parent contact notes, nursing notes, etc. The T-log section is a very powerful communication tool, giving you the ability to not only enter a note on an individual, but when I enter that note, I can share it with other programs. So if someone is in our group home and having a difficult day or being picked up for an appointment later on, we can share it with a day program or any other program. And when we identify our note, it'll pop up on the dashboard of the people that are serving that individual in that program. It becomes a very effective way of communicating with one another in real time. So that's what T-logs are, and lots of that will be addressed in various trainings coming up in the future. General event reports. General event reports is another name for incident reporting. This will eventually take the place of the state incident reporting system that you all have been using, but you'll be able to track all incidents, whether reportable or not. It's a very powerful tool, very easy to do, and there's a whole lot of information about what you can do in terms of attaching photos and other documents and doing your reporting on a quarterly and semi-annual and annual basis of incidents within your organization. Again, all of these things you'll see where it says approve here. I'm an approver of incident reports in our system, so they pop up on my dashboard when somebody enters one that I have an incident to review here that was done on January 8th, and there's a whole process on how I review and approve that and may send it back to the individual for further documentation or clarification, etc. But general event reports is for tracking any and all types of incidents. In fact, probably what I should do up here is just open one up real quick. So that you can see the types of things we can do. Injuries, have the ability to track basically all types of injuries, injury causes, etc. You can track medication errors. We can track restraints if they're and have them connected to behavioral plans. We can track other types of restraints, which related to having procedures done, chemical restraints, death, and other. Of course, that other category is the one that tends to happen on Fridays around 5 o'clock. Maybe accidents, altercations, hospital fire, law enforcement, altercations, etc. So that's what GERs, I've heard people refer to them as a GER. We just call them a GER, or General Event Report, and that is the Instant Reporting Module. ISP data, ISP, the Individual Support Plan. These, of course, are all of the tools about creating a plan and creating goals and collecting documentation on those goals and then running reports on those goals. There are several sections in here that address support planning. You'll see here where it says Individual Support Plan. This is a whole process of doing an assessment and then creating an agenda of the things that came out of the assessment, having a meeting around the individual and addressing their wants and needs and interests. And then those things come into populating the individual support plan and addressing the things that folks all agree to work on during this next planned year. You also have the ability to do a search on plans that are about to expire. We can do some other searching in terms of data collected, et cetera, and that's all around that subject of ISP planning. Maybe just to give you a little bit of things to look forward to, I'll show you real quick here. You have the ability to track any types of goals, and then you have the ability to go back and look at a date period. And run a report. So I want to look at some data and compare the months to each other. And this is a task analysis, and I don't want to look at all the tasks. I just want to look at the total. And I'm doing this rather quickly because there's going to be a lot of training on this. But I just thought I'd show you how quickly that we can run a report, and we can look at, this was a toothbrushing goal, that George's target was that he would be able to brush his teeth 70% of the time independently, or 7 out of 10 times. And just by clicking a few buttons, I can come down here and see that George is at 81% independently brushing his teeth, and 15% of the time he's doing it with verbal prompting. This up here is each month of the quarter and showing me where he was when he started out as his baseline, and then how he did each month, and how that compared to the previous month and compared to the baseline. And if I throw this on a line graph, you'll see I can see the data on the line graph, and there's other graphs and other ways to run these reports and identify your progress and et cetera. So just to give you a little carrot, hopefully that's something that looks exciting. And I hear that the average time it takes to do a quarterly or annual report collecting all the data is about 1 hour and 20 minutes per individual. And as you can see in Therap, you can do this in a matter of minutes. And hopefully for those of you that this is a function of your job, you'll find some great relief in the ability to do this on a regular basis to be able to provide better care and to be more efficient. So that's the whole section about ISP and rehabilitation planning. There's a library of templates. There are dozens and dozens and dozens of templates in here. You can create your own, or you can see what we have in the system. You'll see right now there's 845 templates. So you could come in here and do a search for, like we were looking for toothbrushing, and see how many toothbrushing templates are there. Well, there's about a dozen, and I can open these up and I can look at them and see if I want to import them into our system and use them. Or I could just create one from scratch, and in doing so, once I do that in my library, There we go. Once I create a template in my library, I can save it, and now it's in there that I can apply to anybody else. And I can change it to make it more specific to each individual, but then I have a template all set up with a long and short-term goal and scoring methods and all of that. So that's a little tidbit about goal planning. There's an area for tracking consents and authorizations, document storage area, medication profiles, and diagnosis and allergies and all of that. There is a new section in here. This section here, this first employment section, is about tracking production and prevailing wage studies and things related to paying subminimum wage to individuals that are in training and working in a sheltered employment environment. And this employment volunteering history is the section that tracks supported employment and job placement activities. This is our newest module, and we'll be going over that at the conference and have a webinar coming up later on this week to go through and talk about how it tracks jobs and job placement, various activities. When you see the words personal finance in Therap is about tracking an individual's finances within each home. So if an individual goes to McDonald's on the way to work or on the way home, or you go to, maybe we go shopping at Walmart or Target or something like that, and they're buying some clothing items, and it's coming out of a petty cash fund or it's coming out of another fund. Typically, agencies are saving receipts and doing spreadsheets and sending those receipts back to the corporate office. This is the module that tracks all of that. It's like an electronic checkbook with the ability to scan receipts in and all of that. Under the Health tab, you'll see the MAR. The MAR will be in that round 2 rollout. So it's definitely something you'll want to learn more about, and there'll be plenty of sessions at the conference around the medication administration record. Health tracking is really a phenomenal area that tracks all health-related activity, doctor's appointments. When you schedule a doctor's appointment, it'll pop up on a calendar. So I could actually look at this week's calendar and see what doctor appointments we have that are coming up. I can click this and I can open a consultation form. It will complete the consultation form automatically with all the required information. But then I just print it in PDF, have the doctor sign it, bring it back, and scan it back in, and it's there. So there's a complete appointment management section, health tracking on all these various areas. That then you have this ability to look back and run reports. There's a really pretty incredible report that we can run called a health tracking report, or healthcare report rather, where we just choose an individual, choose a date period, take a look at everything we're collecting, and it'll pull together everything from their disability or diagnosis, all the doctor's appointments that they've been on, what discipline that doctor is within, your blood glucose and weights and immunizations, infection, intake elimination, med histories, and seizures, and et cetera, vitals and incident reports. And it'll pull all that information to a single report, which really gives you the ability to look at a person's whole life and everything that's going on with them. So it's some of the health tracking section. There's health assessments. There's care planning for specific healthcare issues that are being addressed, and physician orders. There's a staff scheduling module. The staff scheduling module is specifically designed to address residential shifts within each home. When you use the staff scheduling module, it'll put the shift on the calendar of the individual. So here was a schedule that we had created, and it took everyone's shifts and names and put it on the calendar for each individual. The training management system is the module that will track all of your staff training. It'll track how many hours of training. It'll track who's had what when. Over here on my panel, this is my training over here, and I can look at my training history, everything I've taken. I can also come over here and look at my profile, which says what I've had when, what's coming up due, is there anything overdue, etc. And then I'll get notifications. There's lots of notifications in Therap that can notify you inside of Therap, and it can notify you outside of Therap to an email address or a text message about various things that you need to be informed about. On my panel, this is telling me that I have a couple things overdue, and I can click these and get more information about them. If something's coming up due, it'll pop up, and if somebody signed me up for a class, it'll pop up and tell me. So that's the essence of the training management system, is the tracking of all of staff's training. The billing system, which will be the last thing rolled out in Therap, it will primarily be for DDSN. You will come in and enter your attendance for residential and day programming through the attendance module, and then DDSN will be able to do the billing from that data. Around the same time that we roll this out, if there are providers that are doing direct bill or want to do direct bill, there will be the availability for providers to consider using Therap for direct billing, and those are the information that we'd be happy to give out at a later date. The admin tab is going to be available to those who are provider administrators within each organization. There'll be lots of training for provider administrators in Atlanta next week. And then for those that aren't going, of course, we'll be setting up training sessions for you. We'll be going over some of these features that will help you set up your account. Agency reports, there's a library of reports in here, which are dozens and dozens of different canned reports, staff reports, demographic reports, etc. And then there's this individual homepage. The individual homepage, again, is where my access to everyone I serve. And if we take a look at George here, this individual homepage is going to give me a snapshot of everything that's happening around George's life in the last 2 weeks. So I can see that we have an appointment, a T-log on about an appointment here. We see a shift note, a couple of incidents. They're all live links. So if I wanted to read this note, I just click it. On the left-hand side from his demographics, it's pulling in his demographic information, allergies and plans he's working on. I'm getting notifications when they're coming up due for review. Here I can see goal data that was collected last on. So I can see here's a toothbrushing goal. Staff last collected data on the 8th. I could come over here and see what goals we're working on, and I can enter data right from here. I could view data, a data list of all the data that's been collected on that goal, or I could just view the program. On the right-hand side, we're graphing health data automatically that's being entered, and I can see any appointments that are scheduled 30 days out. And on the profile button, we can see his allergies, the diagnosis, medications, any active orders, and team members and staff that work with him. On the left side, I see, again, his picture, blood type, age, birth date, other important information, health information that was last collected, and each program that they're in and their enrollment date. That is the individual homepage. Further, I was talking about, let me go into a different account. I was talking about notifications. And notifications become, for different levels of staff, a really incredible way to get very quickly notified of something that was entered into the system. So these are the areas I can receive notifications on. I can receive notifications on incident reports of certain types. Maybe I want to be notified of all high, medium, and low, or maybe I just want to get a notification when a high, medium, or a high. And we'll talk more about that in training, but there's quite a bit of detail that you can give yourself to be notified about any one of these areas. I'm going to jump over to the right-hand side. Whenever you use Live Help, which is down here at the bottom, it will record your conversation in a library for you. So My Issues has to do with your library of when you used Live Help. So you could come back and look at a later date of the conversation that you had with the individual with Live Help. In case you have that problem again, it'll be logged in your library. SCOM is the secure communication system within Therap. It'll notify you when you get a message, so I can read messages. When I send a message, I can send a general message, or I can send a message about a specific individual. And when I do, it's only going to allow me to send a message to individuals that are privileged to see Georgette Bank's information. So it's going to look back and see who are the users that are allowed and privileged to see Georgette's record, and then I can communicate with them about Georgette. The letter module is exactly what it sounds like. It's a module that populates data into a letter format that you can use to send out to family members regarding a meeting or others. Tasks is for tracking various tasks for yourself or others. Kind of already talked about the classes section. Appointments is pulling in appointments for today or tomorrow, and then you have your calendar, which you can add appointments to, reoccurring appointments, and your staff schedule would also be put on that calendar. So I am going to pause right there, and Deborah, let's see what questions that folks may have for our last 10 minutes. And if you have a question, if you could type a question into the question box, then we would be happy to spend our last few minutes in responding to any questions. Deborah, were there any questions during the session that you wanted to take an opportunity to respond to?
No, the only questions were where to find the materials that you had uploaded. So.
And hopefully everybody has found that.
Sure. It sounds like we just had that one question about going over the dates and the plan for the rollout again.
Okay. So our implementation in South Carolina, phase 1, has several rounds, and the first round where we will be setting up, creating your accounts, showing you how to create individual records, both the individuals you serve and your staff records, how to use secure communication, T-logs, incident reporting, and health tracking. And that round is scheduled for April 1st to go live, and we're doing training between now and that time with each of you. And of course, round 2 is the MARS, and round 3 is ISP data and behavioral data, and some additional functionality in the health section. And the timelines for those, again, are April 1st for round 1, and then July 1st for round 2, and October 1st for round 3. But for those of you that are going to the national conference, there'll be some DDSN staff there as well, and we'll do our best to answer those questions for you at that time. We have a question that says, it sounds like this system will be collecting a lot of information throughout the year. Has there been talk with DDSN about pulling yearly reports, such as medication errors, employment, deaf-blind census, et cetera, from the system. Yes, there has been a good bit of talking about being able to pull those reports. To the what detail, probably not up to this time, but certainly the ability to. As soon as you have implemented Therap in certain modules, you will have the ability yourselves to pull any report related to that data that you need. I mean, there's over 1,500 providers, close to 250,000 staff using the system across the country, and long before South Carolina or any other state contract looks at information they need, it's really been designed as a provider system to give you at your fingertips that same type of reporting, whether it be medication errors, employment census, or whatever. So first, you'll have the ability to run those reports for your own benefit. And then secondly, DDSN will certainly be identifying what types of reporting that they want to be able to pull on an individual or an aggregate basis. Any other questions from anyone?
Excuse me, Gary. I think I see a couple of questions that I want to just address here. One is, will providers of case management have access to day service or residential service providers' notes and information for those individuals that both agencies serve? And really, one of the things that happens with Therap is we have really two different types of accounts. We have provider accounts, which you guys will have, and then we have an oversight account, which really has all of the information that you're putting in flowing up. So that question about reports, that's why you would all be using the same platform so that all of it flows up into the state oversight account. But what that also means is case managers that are case managers at a state level are going to see all that information that gets loaded into Therap for the clients that they serve. Hopefully that answers that question as well.
I see a question regarding Therap will Therap work on any device with the internet? Yes, Therap will work on any device. The key is the internet connection. There are the Therap application via the web will operate on anything. There are a couple of limitations. For example, if you're using an Apple iOS system, Apple doesn't support Flash, and so we have a body chart in the incident reporting section that doesn't work in an Apple product. Other than that, everything else will operate on it. There are an Android application, which is a specific mobile app, and of course that would require an Android operating system on a tablet or a phone in order to use the mobile application. But in the first round, that mobile application won't apply. So it won't be until October that you really would want to consider using the mobile application.
Excuse me. The other question there, Barry, that I'm seeing is, will they have access to other agencies' notes and information about clients? And the short answer is, for some very specific things. That is an area that we are very, very careful about because we still want to guard the information for each of your clients to make sure that only the people that should have the information have access to it. So there are a couple of states that actually do share information back and forth between like day service and residential service providers, but there is a very specific information. And what you guys are starting out with, you probably won't be able to do that type of sharing between providers. You certainly could send FCOMs, which is like our internal email system, to each other about the specific clients that you have in common. But other than that, you won't see each other's notes and information.
To answer the question regarding children early intervention services, yes, Therap is used to manage early intervention services for children, and will be to a certain degree for DDSN as well. There are some things that still have to be worked out between the current data that's being collected in the early intervention system and what Therap will be doing in addition to that, and more information will come out regarding that. Wanted to respond to the question about computer system requirements needed to run Therap. Therap's going to run pretty much on anything. I mean, we're going back as far as, I think, is it XP, Deborah? As far as the Windows operating systems?
I believe so, yeah.
So really, it's going to run on anything you have. Again, the internet connection is really the key. Who will be inputting the initial information regarding each consumer? That's a great question. So DDSN is going to do a dump, one-time dump from their system into Therap. After that dump, then you'll have to do updates to those records, and then from that point forward, enter in new records. And we'll be showing you how to do all of that. It looks like we've hit. Yep.
Could you just go over the GoToMeeting control panel on the right-hand side?
Say that again?
Would you just go over the GoToMeeting control panel where they can find their materials that have been uploaded?
Oh, yeah. So on your panel, on the right-hand side, there should be an orange arrow. If you click that arrow, it'll open up the panel. And as you go down the panel, there are different sections. There's a audio section, then a dashboard section, and a materials section. So if you click that materials section, the little plus sign, it opens it up, and then you should see what says Therap Catalog 2014. And then you can click that, and you just choose where you want to download it to on your computer. And all of that's available. If you're having difficulty with that, just go to our website and click Catalogs. And then you can go to the catalog and download any one of the catalogs or all of them. And for those of you that will be coming to the conference, any of the conferences, we'll always have extras available to share with all of you. I guess I'd like to share my email address with everyone. Let's see if it is on our website here. And because we are at the end of our hour, but don't want to leave you all without the ability to communicate with us. So let's see if my email comes up. There we go. So this is my phone number here and my email, barry.pollock@therapservices.net. And Deborah's as well. Let's find you somewhere here, Deb. I'm assuming you're here. And there's Deb. And Deborah's email, Deborah.Brito, B-R-I-T-O, @therapservices.net. And please feel free to communicate with us. We'll be happy to try to answer questions and support you. And look forward to meeting many of you next week in Atlanta at the National Conference. And if you're not there, we'll be seeing many of you soon. So we're going to go ahead and end this at this point. Thank you for participating today, and we look forward to working with you all on your successful implementation of Therap. Have a wonderful week.
Bye.